The key to the successful treatment of common stress fractures in football players is a period of reduced loading. This does not necessarily mean a period of non-weight bearing, although this may be appropriate in certain high-risk stress fractures. Loading is apportioned according to symptoms with activity. The avoidance of aggravating activity until recovery is essential. Alternate loading is important. The use of non- or partial weight-bearing rest activity to maintain aerobic fitness is an important strategy. In addition to reduced loading, there are a variety of adjunctive therapies that have been described. These will be discussed further in subsequent pages. As you will see, some fractures may require complete immobilization or surgery, and specialist advice should be sought. Obviously, the most important factor in being able to manage these conditions effectively is the accurate diagnosis of the stress reaction or fracture. The initial management of a stress injury involves the following. A. Activity modification/relative rest. Decisions regarding the relative degree of rest or modified activity, partial or full weight bearing, complete or relative rest, cast, boot, or sling requirement, and period of rest, are vital. B. Initial management of possible contributing features. While the identification of contributing factors is vital, it is often impossible to identify which factors have played a predominant role in causing the injury. A thorough history combined with clinical instinct and experience play a principal role when deciding which factors need to be addressed to eliminate future risk. As such, it is highly likely a collaborative approach between several specialist practitioners will be required. For example, bone health, dietitian or endocrinologist. Biomechanical errors in running technique, running gait analysis/biomechanist. Inappropriate excessive loading, training, strength and conditioning coach. Footwear poor foot mechanics, podiatrist. C. Maintenance of physical conditioning. It is extremely important for the athlete to maintain a level of cardiovascular fitness, strength, and flexibility as well as mobility in the surrounding structures without compromising the bone healing. This will ensure an expected return to sport-specific training as well as a return to play. Equally, maintaining the athlete's physical condition will play a vital role psychologically once he or she returns to play. Several options exist which should be incorporated to the athlete's rehabilitation, such as hypoxic training, hydrotherapy and deep water running, recumbent and seated cycling, Pilates and specific strength, and cross-training. D. Acceleration of tissue healing. Low-intensity pulsed ultrasound has been hypothesized to accelerate healing times and therefore may be a necessary consideration in the rehabilitation of the injury. Appropriate nutrition is also critical in recovery from injury. Once an athlete is able to walk pain-free for a relatively prolonged period, he/she can generally begin a walk-jog program. This involves the following. A. Commencing running. The success of a return to running program depends on appropriate timing of building in appropriate run-based training. This will completely depend on adequate healing of the structures prior to introducing and increasing running loads. Also, effective management of possible joint, muscle, neural and proprioceptive deficiencies prior to returning to running must be addressed. B. Altered load running. Initiation of running may occur via water running or an anti-gravity treadmill. A graded progression of percentage of body weight is introduced and progressed to 90% of the athlete's body weight, at which stage the progression to full load is accepted. C. Running gait retraining. If mechanical issues associated with running gait have been identified as likely, causative, the timing of running gait retraining must be carefully considered. Introducing running gait retraining techniques must be introduced gradually and carefully. It must be stated that altering an athlete's running biomechanics can take a substantial amount of time, possibly longer than the total rehabilitation process. If a change in running biomechanics occurs too quickly and/or is progressed too rapidly, other foot injuries may ensue. Therefore, end of season or post-season may be the most appropriate time to address biomechanical discrepancies. D. Running loading programs. Running progressions should be gradual in intensity and volume per day and per week. Changes in direction and acceleration-deceleration should be held until adequate reloading quality and quantity has been established by the medical staff and conditioning staff. Post-activity symptoms are a good guide for the appropriateness of the current loading regime. Any prolonged or night pain post-activity suggests that loading has been too high for the stage of recovery, and therefore the loading quantity must be modified. Early in the reloading phase, the athlete is unlikely to gain sufficient conditioning from running, so will have to be complemented with cross-training conditioning options. As such, an athlete's entire loading quantity must be continually monitored. Ongoing management of strength, flexibility, proprioceptive and neuromuscular deficiencies must be continued through the reloading phase. As in all sports, the training specificity of football, and the player's individual position, are paramount to ensure on-field performance and injury prevention. Low-level sport-specific skills can be introduced early in the rehabilitation process and will assist in keeping an athlete psychologically focused. Sport-specific drills should be incorporated at the return to sport phase.